All right, wonderful, wonderful. That's good. That's a good answer. All right. Okay. Now. Oh my gosh, walang sound. Kanina, oh my gosh, walang sound yung ano. Anyway, hang on a sec. All right. Okay. Now, let's continue on with our discussion. Hala, walang sound yung first 20 minutes ng discussion natin. But anyway, that's not usually the we don't have a lot of things to discuss. I'm just giving you a, what do you call this? I'm just giving you an overview of what we're going to expect in malaria. Okay? And then we're going to move on to the next topic, HBC. What is the abnormality in a patient with HBC? Very simple. That patient suffers from that patient has a mutation again on the 6th amino acid. Alright? And instead of glutamic acid, that patient inherited the gene that substitutes lysine for glutamic acid. Okay? So again, on the 6th amino acid. Sorry about that. Alright, now let's talk about the peripheral blood picture, or the blood picture of a patient who is suffering from HBC. They have what you call HBC crystals. Okay, they resemble the Washington Monument, as you can see here. I don't know if it's clear, if it clearly looks like it's a Washington Monument, but they do form crystals. Okay, hence if you encounter a question and then they showed you a picture of this that has what you call a Washington Monument, you might benefit from remembering C for crystals. Okay? HBC. Sabi ni Sir Manuel, crystals yon. Okay? So it's one of the few hemoglobinopathies that we're going to discuss that produces a crystal instead of an inclusion body. Okay? Or a morphological transformation. All right. How do we'll add an E here, okay? Sorry. Okay, so how do we differentiate trait versus disease? So same like earlier. Trait is asymptomatic. Its genotype or phenotype is what you call, it has something like this. All right, you inherited an A gene, and instead of a beta gene, you inherited a C gene. Okay, a disease. The disease trait of that one is one gene of C and one gene of C as well, and they have an asymptomatic. They are symptomatic, and this often results to RBC destruction. Now, I'm going to ask you guys another question, a true or false question this time. There are cases of combined inheritance of HBS and HBC. Is it true or is it false? Can you be that unlucky to inherit both? What do you think? Is it true or false? Can somebody in this world or in this lifetime be that unlucky? that they would inherit HBS and HBC at the same time? True or false? Anybody? Aba, Charis, hindi ko alam. Kaya nga ako nagtatanong eh. Ikaw talaga, Charis. kaya nga ako nagtatanong, Charis eh. Ito si Charis, niloloko ako. True or false? My question is true or false? True. Okay, alam niyo na yung next question ko. Sino sumagot ng true? Si Norin. Alright. Alam mo na next question ko, Norin. Paano mangyayari yon? How does that happen? Hala tayo. Kayo talaga. Tama naman yung sagot mo. Ikaw talaga. One parent might be HBS. Alright? Might be a person who inherited the full dose of HBS. And another parent might have inherited the full, or is a carrier. Okay? And that person is unlucky enough in life's lottery, that person got the short end of both sticks. Right? Now, my next question is, for anybody here, can these people live a normal life? Yan ang magandang question. Can these people live a normal life? They inherited both S and C gene. Ang hirap ng mga tanong. Napaka-profound ng mga questions mo, Sir Manuel. Ano nangyari? Napaka-profound. Can these people live a normal life? Tut. Wala na, hindi na sila nakasagot. Sige, ako nasasagot. Yes, they do. They can. They can live normal lives. Why? You inherited HBS. Alright? A half dose of HBS, a half dose of C. Right? You can still have a normal life provided that you avoid anybody? Grabe naman to si Adrian, napakasama naman, no kagad. Provided that ano yung 5 conditions? They avoid hypoxia. Alright? If they avoid hypoxia, their cells will not sickle. You understand? The cells will not polymerize. Okay? So meron sila, the most important thing for these people is at a very young age, they need to be diagnosed as early as possible so that there shouldn't be an episode of organ failure at the neonatal level. Okay? So they can still live a normal life. Okay? Ano ba talaga, Adrian? Sumasakit talaga ang ulo ko sa mga students ngayon. Cool? Very easy to understand, right? HBS, 6 amino acid, valine instead of glutamic acid. HBC, the problem is lysine, substitution. What position? 26. HBE, 26th amino acid, the substitution is lysine. Very easy? Hindi masyadong kailangan i-memorize, right? Again, there are inheritance patterns that you are going to expect from these types of patients. This is what we call, again, trait, disease, and what you call a heterozygous status. Okay? Heterozygous status. Ano na naman yan, sir? Panapahirap. Ang dami. Napakadami, no, sir? Hindi ko na nga sinama yung hemoglobin O at saka yung hemoglobin lepore eh. Kasi para hindi kayo ma-stress. Kasi usually it's very rare. On rare occasions, they would ask you about hemoglobin lepore and hemoglobin O. So don't worry about it. But all you need to remember is that there's three variants of hemoglobin O. Kala nyo COVID lang ang may variant, no? No. Hemoglobin O has the Indonesian variant, the Arab variant, and the I think the Java variant. No, Indonesian variant na pala 'yon. Dalawa lang ata. But I know there's three. Okay? Then hemoglobin lepore is something that cannot be easily detected. Okay? Because it always comes with hemoglobin A. All right? A1, sorry. So, yun lang yan. You don't need to delve deep into that. But we need to delve deep is in the three hemoglobin variants what we're discussing right now. Okay? So, epidemiologic occurrences or the distribution. Usually, the patients who have HBS are from a sub-Saharan tribal India or Middle Eastern descent. Okay? Those are the people who would expect to have HBS. All right? Pero sabi mo, sir, meron kang pasyente na may HBC. Ibig sabihin ba nun nakipaghalo-halo na ang ano nila? Yes, that could happen. All right? HBC is from a West African descent, from a person who is a West African descent. Why am I explaining this? Actually, epidemiology is also something that you need to be mindful of, primarily because primarily in case presentations. Okay, a Middle Eastern in the emergency room suffering from bone pain, joint pain, as well as difficulty in breathing and edema in both upper and lower extremities. Hemoglobin electrophoresis has been done on the patient, and this is the result as follows. Identify what hemoglobin variant is predominant in this patient's serum or in the patient's hemoglobin. Yun usually yun, and you can have a clue of what particular hemoglobin variant you can have based on the patient's clinical presentation and his what do you call this, nationality or whatever it is, or descent, where he came from. Okay, so that's the reason why it's important. And sometimes they would ask you directly, the patient is Asian. Obviously, Asian people have E. Para hindi makalimutan, sinasabi lagi sa amin sa review center, they would always remind us, HBE is Asian. Para hindi nyo na makalimutan. Diba? Asian. Alright? Gagamitin mo lang yung accent ng Nigerian accent. Oh my God, that patient is Asian. He has hemoglobin E. Alright? HBC, crystal. Alright? Nigerian nga pala ang accent ko. Okay, West African. Alright? HBS, Sub-Saharan. S, Tribal Indian, and Middle Eastern. Alright? So, madali lang maalala, di ba? Asian, alright, West African, and Sub-Saharan. Alright? Now, quick review of thalassemia. What is thalassemia? As I mentioned before, it is a quantitative hemoglobin disorder wherein there is a decrease in the amount of beta globin and hemoglobin and alpha hemoglobin structures. Sandali, may kumakatok. Galit na galit, may kumakatok. First time to dito sa lecture ko na may kumakatok, ha. Sandali. Alright, may kumakatok, sorry. Alright, sorry. May kumakatok kanina. Okay. Nasaan na tayo? My God. Napaka-jahi talaga. Napaka-jahi ng lecture ko dito sa Pilipinas, ha? Alright, let's move on. A quantitative hemoglobin disorder wherein there is a decrease in the amount of alpha or beta globin chains, okay? And you got to be mindful of the thalassemia nomenclature. What do you mean by nomenclature? How they name the thalassemias, okay? So there's an alpha thalassemia and a beta thalassemia. Which one is affected? In alpha thalassemia, there is a decrease in the alpha chains, all right? Usually as a result of a mutation in HBA1, all right? So it's so you guys please don't forget pag sinabing HBA1, it's the one that is responsible for the production of alpha. Okay? For A2, it is the one responsible for the production of alpha, beta, gamma, and epsilon. All right? Beta, gamma, delta pala, and epsilon. So as we grow older, there's a steady decline in the function of the A2 gene. So please be mindful of that one. It might be asked in your exams. Because I remember one of my classmates, this was one of his questions that he encountered. This is one of the questions that he encountered when he took the ASCP examination. Okay? Now, beta thalassemia. There is a decrease in the production of beta gene, of course, and usually as a result of a mutation in the HBB gene. Alright? So very easy to understand. If it says alpha thalassemia, the one that's affected is the alpha chain production. If it's beta thalassemia, there is a beta chain problem. Okay? Now, what's the major difference between major and minor based on genetic inheritance? Major is there's an abnormality in two or more genes, resulting to a decreased production in the globin chain. And minor means that there is an abnormality in one gene. Alright? So when we say beta thalassemia major, two or more genes are the problem. Let's go back again to our paint. My illustration earlier. Where's paint? Paint. Okay. I'll be presenting something to you guys again. Okay. Stop presenting and window. So this is how you differentiate beta thalassemia major from alpha thalassemia first and alpha thalassemia major. This is just a review. We've already discussed this a couple of weeks ago, but I'll just give you guys a general overview of what you might be expected to answer in your exams. Okay, so let's talk about first alpha thalassemia. Alpha thalassemia, you inherit. This is the appearance of your alleles. Okay, alpha. Okay, another alpha here and another alpha here. All right, clear? That's the normal inheritance. Why is there 4, sir? For beta, it's like this only. Beta. Okay. It's confusing, sir. Ay, bakit nang isa? Alright, so for beta, it's like that. Ignore my handwriting. Okay, I don't write good in this particular scenario. Now, for example, you have alpha thalassemia minor. What do you think is the inheritance pattern that you're going to have? You're going to have either this one for minor, right? This is for minor. Let's denote it as MI. Alright, for minor, it's like this. You've inherited this one, slash, okay? There is going to be a deletion here, okay? A deletion of the gene here, and another gene here. Alright? So that's minor. Another form of thalassemia minor is like this. Alpha thalassemia minor is something like this. Okay? You see the difference? You see the problem, or do you see any problem in the patient? Will this patient suffer the full dose of alpha thalassemia? What do you think? True or false? This patient can live a normal life. Anybody? Hirap, no? Actually, even medical students, they have a problem understanding these questions. That's why I want you guys to I want you guys to ask me if if something is difficult for you, okay? Because even medical students, they still have a hard time grasping the concepts of thalassemia, which is actually one of the most difficult topics to discuss in one of the difficult topics that is discussed in hematology, okay? So ibig sabihin, what do you mean, Adrian, by no po? Sorry, I was not able to understand the context of why you said no po. No po what? Can they live a normal life? Ito na naman tayo. Ang hard mo talaga, Adrian, sa mga tao. Can they live a normal life? Tapos sasabihin mo na naman. Lagi na lang sinasabi ni Adrian, no po. Alam mo, Adrian, you're very prejudiced. Pagka may sakit, pero anong klaseng thalassemia? Yun yung tinatanong ko. What I'm asking is, can this patient live a normal life? When I say, can they live a normal life, do they need to have continuous hospitalization, blood transfusion, what else? Continuous testing for hemoglobin electrophoresis or HPLC, high performance liquid chromatography. Do they need to be monitored 24/7 for their activities? That's what I mean by can they live a normal life. Baka mamaya naman yun, nililibak mo yung pagkatao nung pasyente. Hindi naman ganon, ha? Parang no po agad without discussion. Ikaw talaga, Adrian, ha? Ikaw, Adrian, ha? Yun yung ibig ko sabihin pag ano. So sa tingin mo tong pasyente na to, kailangan ba niya ng mga ganon? Continuous medical treatment or diagnostic tests? Adrian? Ano? They can live. Why? Sige, why? Explain to me why. Patay. Pag tinanong, napansin ko pag tinanong lagi ng why, doon tayo medyo nahihirapan. Alright, let me explain to you guys. Remember when I said the word quantitative hemoglobin disorder? The amount of hemoglobin is being produced, the amount of hemoglobin being produced is decreased, and therefore, there's still production, but it's a decreased amount, right? So, in our first example, it's considered as thalassemia minor. Asymptomatic, actually, these patients have an asymptomatic case presentation. And you would never actually assume that the patient has thalassemia minor. But there are some times that, especially when they give, when this person is a female, they give birth, or there's an underlying condition, that's the time we can discover that they have thalassemia minor. Or alpha thalassemia minor. Why? There's still three genes that still produces there's still three alpha genes that still produces the alpha globin chain. So that means that they can partly live a normal life. That for most part, they just need to take care of not getting pregnant at an early age, or at a stage of their life that would make them susceptible to anemia. Okay. Now, our second case is a little bit what do you call this? It's a little bit too suspicious. They can suffer from mild forms of anemia. Okay? Mild forms of anemia. Why? Because there's only two globin chains, two alpha globin chains that's being produced in these types of patients. Okay? All right? So that happens severe anemia happens when, again, there's a case that they might have gone from an accident, they might have been in an accident, okay, and they needed blood transfusion. Sometimes the physicians will just discover, is this patient why is this patient being presented as anemic, but he's never suffered from any form of anemia before? Okay, so occasionally they might suffer an acute syndrome of anemia, but they would necessarily live a normal life. They would not be subjected to the third one, our third case, which is considered as major. Why is it major? I think you can see the pattern here. Okay, there's a deletion in the alpha globin chain here, another deletion here, and then alpha chain. These are the patients who will suffer from major thalassemia. Okay? Another case presentation is something like this. Alright? Deletion of a whole deletion of the alpha chain. Okay? What type of hemoglobin do these patients produce? That's the next question. Alright? But this is just a review, but I want you guys to ponder on it. We've discussed it earlier. You can see it in a reticulocyte stain. It appears as golf balls. Kalimutan nyo na? Kaya ako inulit kanina. What's the hemoglobin that they produce? Deandra, what's the components of HBH? What's inside HBH? It's a tetramer. Di ba sinabi ko tetramer? Bakit ba? Ano ba kasing structure ng hemoglobin? Sumasakit ang ulo namin, sir. Hemoglobin is composed of alpha, and then may beta sa loob. Dalawa, beta. Okay, so what happens? Beta. Ano ba? Apat na ba yung beta ko? Sorry. Ayan. Malabo mata. Alright? Okay. So what happens is they have what? They have 4 beta globin chains. Okay? 4 beta globin chains. Sorry, HBH. Yeah, 4 beta globins. Alright? Now, we're going to talk about cis and trans mutations. Okay? Which of the following is a cis transmutation or cis mutation? Mutation 1 or mutation 2? Ay, hindi ko pala na-present. Sorry naman. Hindi pala siya na-present. Sorry. Okay. Presenting now. Medyo mabagal talaga ang discussion ko ngayon dahil sa internet. Hindi siya naglo-load kaagad. Alright? So, okay na. Nakita nyo na? Okay na po. Presenting. Alright. Okay. Alright. So, what is the main, which of the following genotypes is a cis mutation, and which of the following genotypes is a trans mutation? Okay. Pili kayo dyan. Sige, magtanong tayo randomly naman, yung hindi naman sasagot. Magmili tayo. Let's go and ask Miss Angel Montalvo. Ay, biglang nagtago. Miss Angel Montalvo. Case 1 or case 2? Which of them is a cis mutation? You can use the analogy. Which one? Which one is cis? We're asking cis first. Chillax ka lang. Isa lang muna. Pili ka. 1 or 2? Okay. Alright. So, your trans is letter A. Number 1. Letter A tuloy. Number 1. Let's see if you answered correctly. Congratulations. You answered correctly. Right? So, look at the pairs again. This is a gene expression of, basically gene inheritance pattern of somebody who has what we just discussed earlier, of somebody, right? Alpha thalassemia minor, alpha thalassemia minor also, but the expression is different. Cis is inheritance on both sides of the allele, or one allele. An allele is one side here and one side here, okay? Can you guys see it? So in one, there's one side here and another one here. You can see it, right? Where my mouse is pointed at. Right? So this one is a trans one. Why? There's a mutation on both sides. Okay? This one is cis because there's a mutation in one side only, or a deletion. Alright? This could be also referred to as a cis or a trans deletion. So sometimes you might be asked the question, a patient who which of the following patient has inherited a cis alpha thalassemia trait? So, diba? Trait. Kita nyo from the name itself, trait, not a disease. Pag sinabing trait, okay, nagpo-produce pa rin siya ng alpha hemoglobins, alright, he still produces the same amount of alpha hemoglobins, fine. So it means that it's not a 3 or 4 deletion. I would still consider it as minor, alright? It's just 2 and below. Now what I need to know is cis. So if it's cis, it's on both sides, or in one side, sorry, it's on one side of the allele only. The deletion is only on one side. Okay? So the reason why I'm saying this is because this will come in handy later on when we discuss hemoglobin electrophoresis. Okay? Now, let's talk about another question. Can thalassemia and sickle cell anemia be inherited concurrently? In Tagalog, pwede bang sabay? Kung nakikinig kayo sa discussion ko last time, kung nakikinig kayo sa discussion ko last time, maalala nyo yung story ng katrabaho ko, right? So it is true. You can inherit, you can be again one of those people who are unlucky enough at life and lose the life lottery, and you can have beta thalassemia sickle cell trait, or you could have beta thalassemia HBS disease. All right, so you inherited 2 gene mutations of there's patients who've inherited 2 mutations of HBS genes and also a thalassemia trait. So bale, these patients, they have an abnormality in their what? Alpha or beta gene? Beta gene. All right? So again, it might be another question that you might encounter in the exams. Okay? It could come out as a statement form. All right? There are individuals. Okay? So the answer is true. There are individuals. Oftentimes they're related to the beta gene. Okay? More often than not. There's very rare cases. If you look at your Henrys, if you browse the book that Henry used, if you use your Henry books, try opening it once in a while, you can see alpha A thalassemia. What's alpha A thalassemia? There's a problem with the A gene, okay? And they have thalassemia beta minor. You would see a lot of those things. It's usually associated with the nomenclature. You can see it based on the nomenclature. What's the problem with this patient? So again, you can encounter it in a statement form in your exams. So I'll give you again another example question that one of my friends shared to me. One of the questions was, which of the following is an abnormality of a patient who has alpha thalassemia B major? All right, so you're going to see something like that. Or which of the following is a problem with the patient's a patient with HBS beta thalassemia major. All right. So you will see in the choices his or her beta genes, the number of globin chains being produced. Okay. You will also see the sixth hemoglobin is substituted to this and that, and all of the above, none of the above, something like that. You'll encounter something like that. Okay. So please be mindful of these discussions because it's not as easy as my previous exam, as my previous post-test and pre-tests. Okay? Now, let's talk about the abnormal tetrameric hemoglobin structures. We've discussed HBS, HBC, HBE. We also discussed, we made the review, we also did the review on your thalassemias, how nomenclature happens, how the names come about, and how they combine with S, or with the S abnormal S genes. Now we're going to talk about the tetrameres, abnormal tetrameres. So there's two forms that you need to be mindful of. We've discussed it earlier. This is HBH and Bart's hemoglobin. Okay? HBH is a beta chain tetramere, meaning that the only chains that these people produce is the beta globin chain. Okay? Bart's hemoglobin, on the other hand, there is a problem on both alpha and beta gene production. Really, sir? That can happen? Yes, that can happen. And to compensate for this, the gene producer makes up delta chains. Okay? And usually these people, they don't survive very long. And hence the term hydrops fetalis. Okay? The term hydrops fetalis will come into mind. The moment they come out of the womb or enter the world, they usually die. Because the only thing that makes them survive is the fetal maternal blood exchange. Okay? Now, let's review hemoglobin electrophoresis. This is something that you need to be mindful of. In my AACP examination, they asked me 2 hemoglobin electrophoresis questions. Okay? And this is something that you need to be mindful of. I did not put a lot of emphasis on the theoretical portion of hemoglobin electrophoresis because I suppose it was discussed to you already, not just in hematology but also in clinical chemistry, so I'm not going to delve deep into that. What we're going to do is basically is more or less a practical understanding of hemoglobin electrophoresis. Okay? Now, what sample do we use for hemoglobin electrophoresis? Anybody? Sample. What type of sample do we use for hemoglobin electrophoresis? Hemoglobin electrophoresis, sir. Ang sakit sa ulo. Ano nga ba mga samples natin? Saliva ba? Ano ba? Stool ba? Urine? Blood. What type of blood? What type of blood? What? Come again? What type of blood? Yeah, you're correct, but there's a lot. You remember, you're a medical technologist. You're a future medical technologist. And as for a future medical technologist, you need to understand that you can't just answer blood. What type of blood? EDTA, heparin, citrate, or very good. Now, we have to be specific in terms of hemoglobin electrophoresis. And one of the things that we usually do in the laboratory is pre-treat the samples, the EDTA blood. Okay? We use the EDTA whole blood lysate. So, why do we need the lysate, sir? This time, lysed samples are important. Why do we need to lyse the cells? Why? Because inside the cells, or inside the RBCs, what can be found inside the cells of the RBCs? The hemoglobin. Alright? So, when you lyse the cell, you release it into the patient's plasma. Alright? You understand? Okay? So, we need EDTA whole blood lysate. Alright? Now, principle of hemoglobin electrophoresis, it's very simple. It is the mobility of hemoglobin proteins when they are activated on an electrical field. Alright? They move from either the anode to the cathode, depending on what type of hemoglobin electrophoresis we did. There's two types, acid electrophoresis and alkaline electrophoresis. And the most common one that we use is alkaline electrophoresis. And we're going to discuss them both together today, because this is usually what you're going to encounter in the exams. Okay? Now, so the main major differences of alkaline electrophoresis, obviously the pH first, 8.4 to 6.0. 8.4 to 8.6. Sorry, let me correct myself again. 8.4 to 8.6. Okay? It's done in cellulose acetate. Okay? It's done in cellulose acetate. And it is going to assess the movement of particles or proteins from the cathode to the anode. Okay, from the cathode to the anode. Next, acid is done on citrate agar, and the pH is at 6.2 to 6.4. Very medtech na itong mga pinag-uusapan natin. More or less, you will encounter this in your examinations. Alright? Next, maybe 95% of the time you will encounter this on your questions. So I want you guys to please listen. Okay? Now, electrophoresis patterns or electrophoretic patterns observed in alkaline versus acid electrophoresis is as follows. Alkaline, you start first with the positive and negative positive to negative charge. Okay? What is the positive charge? The anode or the cathode? Anode or cathode? Clinical chemistry review muna tayo. Patay. Ayan, nakita ko ngumingisi si Joanna. Nakita ko ngumingisi si Joanna. Nakalimutan na. What's the positive charge and what's the negative charge? Anode is positive. Very good. Alright. Bigyan ko kayo ng shortcut. Nakita nyo yung T sa cathode? Ibig sabihin nun, yung kapartner niya, negative charge. So, yung kapartner niya, positive charge. So, siya, negative charge. Gets nyo? Yung opposite ni cathode, may T na siya, ibig sabihin nun, positive. Diba? Ibig sabihin siya yung negative charge. Yung kapartner niya, positive charge. Huwag na nating alalahanin si anode. Ibig sabihin nun, positive na si anode. Gets nyo? Cool? Madaling alalahanin? medyo hindi. Ang sakit sa ulo. Bala ka dyan, sir. Basta ganon. Positive charge si anode. Negative charge kasi si cathode kasi meron siyang T. So yung kapartner, parang sa battery, kita nyo? Yung palagi siya may positive and negative. Tandaan nyo lang yun. Maintindihan nyo siya. So anong ibig sabihin ng CSFA na to? Yan na yung hemoglobin na pinag-uusapan natin kanina. Yung mga hemoglobins na pinag-uusapan natin kanina. Kita nyo? C, yung hindi gumagalaw. Alright? S, galaw ng konti. F, and then ang fastest is of course A. Alright? Kasi why? Because this, the electrophoresis, or when you electrophorese a sample, it only occurs for at least about probably 20 to 30 minutes and then it stops. Okay? Why? Because we don't want them to all migrate on one side lang. Okay? Kaya meron tayong tinatawag sa chemistry na troubleshooting hemoglobin electrophoresis. Right? You see something like, you see questions in your clinical chemistry exams that what troubleshooting procedure should be done? Should you decrease the amount of time of electrophoresing? So yon, that's why we usually do it for 10 minutes only or 20 minutes. 20 to 30 minutes for hemoglobin electrophoresis. It's because we don't want the hemoglobin particles to migrate on one side of the agar. Okay? So you need to be mindful of troubleshooting. I'm not going to discuss it here because we're focused on mainly hematology questions. Okay? Now for acid, it's quite different. It's CSAF. Okay? CSAF. As opposed to alkaline, it's CSFA. Alright? And it's not the opposite. Okay? It's not the opposite. It's actually different. The origin, or the point of origin, is at the the point of origin of the sample is in the middle. Okay, it's delivered in the middle of the plate or of the agar gel or the citrate agar. And what happens is the cells migrate to where they have an affinity to. Okay, so usually the one that moves furthest from the point of origin is the fetal hemoglobins. Okay, so for alkaline electrophoresis, the origin is at the cathode. For acid electrophoresis, the origin is in the middle of the agar plate, and the proteins will separate where they have most affinity with. Okay? So clear? Clear? Okay. We can move on. I've already answered that question for you guys. Sample enters near the site of the cathode or the negative side. The separation is based on the net charge. Okay? For acid electrophoresis, the sample is entered in the middle of the media, and the protein separates on both sides of the media depending on the charge. Okay? The separation is based on hemoglobin structure, not mainly on the net charge. Okay? So sir, bakit kailangan gawin pa yan? Kasi pag tiningnan nyo, wala dito pag tiningnan nyo dito, wala dito si hemoglobin E. Nakita nyo? Nasaan dyan si hemoglobin E, sir? Nasaan dyan? Madami pa actually yan. May iba pa yan. Pero ang papatandaan ko lang sa inyo yan. Ang important para sa akin. Alam nyo bakit? High-yield question siya. It's one of the most high-yield questions in the exam. Alright? Kaya yan yung pinatandaan ko sa inyo. Okay? Now, we're going to answer, before we go on break, we're going to answer questions associated with hemoglobin electrophoresis cases. And this is how you're going to encounter it in the exams. Okay? This is normal hemoglobin. But, sir, ba't ang dami? Saan dyan ang Saan dyan yung acid electrophoresis? Saan dyan yung alkaline electrophoresis? Ang sakit sa ulo. Pinasasakit ko talaga ang ulo ng mga students. Sige, sinong magaling dyan na makapagsabi sa akin kung saan ang alkaline at saka saan dyan ang acid? Ignore the arrows on the right picture, okay? Just focus on what's inside the boxes, okay? Now, who here can tell me which one is the normal hemoglobin band of the patients? Papaalala ko, ang normal natin is CSFA. CSFA. CSAF, CSFA. Alright, so which one here, we're going to work on the right side first. Is this acid or is this alkaline hemoglobin electrophoresis? Ang hirap sir, no? Mamaya explain ko sa inyo, huwag kayong mag-alala, kayang-kaya natin to. Tuturuan ko kayo kung paano. Hindi ko lang alam kung maalala nyo na during exam day, pero tuturuan ko kayo ngayon. Just repeat the video over and over again if you don't get it. And if you don't get it, please ask me a question now because this is a very difficult concept to grasp for some students. Okay? So, si Rhett? Okay, sige. Sino sa tingin nyo ang tama? Si Joanna or si Charis? Ito lang muna pinag-usapan natin na itong nasa left side. Okay? I want people to vote. I want to see on the chat room. So, sino ang tama? Si Charis? Team Char ba tayo? Or Joanna? Sige. I'll give you guys a minute. Grabe naman to si Sir. Ang hirap naman ng question. Umpisa pa lang. Paano namin masasagot kung alkaline or alkaline hemoglobin electrophoresis to? Okay, 1 minute. Walang bumoboto. Gusto ko ng botohan. Gusto ko may ilalaglag kayong estudyante. Gusto ko meron kayong isusupport. Kasi remember, ilang araw na lang. Team Joanna, Team Char. O, diba? Yung mga lalaki lang yung sumasagot, but yung mga babae medyo pa safe. Ano to? Oh my God, na-miss ko siya, Mito. Mabilis na. Guys. Joanna. Grabe kayo kay Charis, ha? Charis, grabe sila sa'yo. Hindi ka daw kapanipaniwala, Charis. Charis, hindi ka daw kapanipaniwala. O, mas madami ang Joanna. Okay. Team Char or Team Charis? Nanghula lang naman ako, sir. Kaya naman pala sila walang tiwala sa iyo eh. Ikaw talaga, Charissa. Okay, time's up. Okay. Alright. So, the winner is actually Team Char. This is alkaline electrophoresis. Okay? So, paano ko nalamang alkaline electrophoresis? Kasi, this one, CSFA. Okay? Look at this one. And look at this one. What type of patients will have a fat band on their on hemoglobin S and a small band on hemoglobin hemoglobin F? Patients with HBS trait or HBS disease. Kasi mas madaming hemoglobin eh. girl, sakaling kita. Hindi ganun yun. Baliw. Alright. Patient with HBS trait. Okay? This one. Paano mo ulit masusupport? Ginagamit natin controls 3 kapag ka alkaline electrophoresis. Okay? 3 kasi ang ginagamit nating controls. One for each bands. Okay? 1 for each band. CSFA. Okay? And then, 2 controls for sickle cell trait and sickle cell trait. Ito pala, sickle cell trait and sickle cell disease. Okay? Paano ko nalaman na may sickle cell disease to, sir? Kasi look, may fat band. Okay? Ibig sabihin, abnormal lahat ng HBS hemoglobin niya. And most of them, they produce hemoglobin S. Okay? So, bakit may fetal hemoglobin pa, sir? Bakit mo kami nililito? Kasi, to compensate for the absence of normal hemoglobin B, the patient will produce hemoglobin F instead. Nagets nyo? Kanina, di ba, may sinasabi ako kanina, kay Bart's hemoglobin, ang pinuproduce ng pasyente since wala siyang hemoglobin A, wala siyang A band at saka alpha globin and beta globin, nagpo-produce siya ng delta instead. Nagets mo? Nagets nyo kung bakit ko inexplain sa inyo kanina yung pinuproduce ni HBA1 gene? 4 na genes yung pinuproduce niya, and in the absence of one, the other one will be produced. If you were listening to me earlier, guys. Okay? So, kaya ko malalaman na sickle cell disease to? Kasi a fat band on the S1. And then this one, look at the difference here. Sickle cell disease, sickle cell trait. There is an abnormality, but remember, in trait, you only inherited one part. Okay? You only inherited one part of the gene. You only inherited it on one part of your allele. Okay? So therefore, you're still producing alpha hemoglobins. You're still producing normal hemoglobin, but at the same time, you're also producing sickle cell cells with the sickle cell gene. Gets mo? Gets nyo kung bakit trait, bakit disease? Mas madaming HbS ang patients with hemoglobin S disease. And to compensate for the production of HbS, to compensate for the absence of normal hemoglobins, you need to these patients produce hemoglobin F. Gets? Kaya ko nalaman na acid electrophoresis at saka alkaline electrophoresis, because we always use 3 controls, because we want to identify first if the machine can actually tell accurately if we're reading the samples correctly. Okay? Now, let's move on to the fourth one. So ano to? Anong hemoglobin ang predominant sa patient natin ngayon? Ano ngayon ang predominant sa patient natin ngayon? Sino makakasagot? So, C, S, F, A. Tanyo? So, ibig sabihin, this one is our patient. Hence, normal hemoglobin. Punta tayo sa acid electrophoresis. First band, we need to have a control for all 4. Means that the machine can separate different hemoglobin variants. Okay? This one is sickle cell disease. How do I know it's sickle cell disease, guys? There's a fat band on the S. And a small amount of fetal hemoglobin. Alright? Why again is there a small amount of fetal hemoglobin? Because in patients with sickle cell disease, they've inherited on both alleles, they've inherited the mutated gene. And to compensate for that, the body produces hemoglobin F. Gets? Cool? We can move on? Now, bakit sir dito na-move? Kasi sa acid hemoglobin electrophoresis, nagbabago sila ng dalawa. Okay? Remember, we're using the middle portion. Okay? We're using the middle portion this time. The port of entry is in the middle. And they will just separate based on their structure. Okay? Now, challenge for people here. See? Acid, fat band in the A region. This is the A region here. This is the A region here. Okay? Cool? Understand? Now, let's move on to sickle cell disease. So, sickle cell disease is this one. Okay? Alright? This one is sickle cell disease. This one. What is the problem with this patient? What does this patient have? Wala na akong ginamit na controls. Challenge ko kayo. This is negative to positive. So this is alkaline electrophoresis. Sige, sagutin, guys. So this is alkaline electrophoresis. I'll give you guys a minute to answer. Sir Marco, nakakatuwa yung itsura nila pag nagsasagot sila. Kasi parang hirap na hirap sila. Yung mga nakakunot yung noo. Baliw. Parang nag-iisip naman si Angelica, nakita ko siya nakakunot yung noo talaga eh. Tsaka si Diandra. So may 1 minute pa ha. So sabi ni Charis, trait daw. Okay, sige. Okay. Kinumpleto pa talaga ni Charis yung sagot niya, no? Natutuwa ako kaya gusto ko makita yung faces nila kapag I want to see their chunky faces when they're answering questions. Ako magbabanggit. Ikaw bahala ka. Ako ayaw mo magbanggit, ako magbabanggit ako. Sino nga ba? Wala eh. Wala akong nakitang mukhang constipated eh. 9 people lang yung nakikita ko sa screen ko eh. Si Ana Jamema talaga parang isip na isip talaga siya eh. Parang yung may theme song sa ano niya, sa utak niya. Tut, 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 tut. Gawa ganon. Alright, time's up. What's everybody's answer? Leandra, what's your answer? Leandra, what's your answer? HBSASA. Nagturo ba ako ng HBSASA kanina? Sakaling kita, Leandra. Okay. Nagulat ako. Sabi ko, SASA? Quadruple mutant na yun ah. Okay. What about Mayra Gagazo? What's your answer? Ano daw? Sabi ni Mayra, parang nakita ko lang ganun eh. Okay. Joanna, what's your answer? Confidence ha, confidence. Dahil hindi kita marinig, Dahil. Unmute. Okay. Sabi ni Charis, SA daw siya. Okay, so sa iba naman tayo. Noreen, what's your answer? Okay, hemoglobin SA then. What about James? Okay. Ngayon, sino ngayon makakapag-explain sa akin bakit hemoglobin SA? Tama kayo lahat. Pero my question is, bakit SA? Iyon ang mahirap. May nagsalita sa, may nagchat sa ano. Bakit ka nalito, Charis? Sasakaling kita, Charis. Sino makapag-explain sa inyo? Bibigyan natin ng pasalubong. Idadagdag natin kay Diandra at saka kay Ana Jamema. Sino makakasagot? What about Adrian? Parang hindi ko nakikita si Adrian ngayon. Ano daw? Ano daw? Hindi ko narinig. Alright. Anybody? What about Rainiel? Sir, kasi sa suckle cell trait po, wala tayong pinag-usapang suckle cells. Pero sige, I would assume that sickle cell. Meron po is HbA2 tapos F. Sickle po. Tapos nagpakita po siya sa A. Ha? Nalito ako sa sagot ni Charis. Anong pinag-usapan natin? Electrophoresis acid, 'di ba? Ay alkaline electrophoresis. Paano ko nalaman? Kasi may positive charge, may negative charge dito, may positive charge dito. Gets? Hindi ko na kailangang tingnan yung controls niya. CSFA. Okay? CSFA. Sickle cells, ibig sabihin merong portion ng hemoglobin niya nagpo-produce ng sickle cells. How did I know? There's a thin band in the S region. Okay? What about this region? It's in the A region, right? Why is this still there? Ibig sabihin, there's a portion of his cells that produces normal hemoglobin variants. Gets? Therefore, the correct answer is sickle cell trait or HBSA. Okay? Cool? So, tama kayo lahat, but the explanation, medyo worried ako, Sir Marco, kasi pag tinanong na sila nitong exam na to, sa question na to, pag hindi ganito ang lumabas, patay tayo. Paano kung pinapa-explain sa inyo? Why is this hemoglobin HbA A2. Why is this hemoglobin HbF? O, 'di ba? Doon tayo mahihirapan. Or which of the following is a patient with sickle cell trait? Yun yung mga natatakot akong questions para sa kanila. Concept. At saka yung concept, sir. Kung bakit. Yeah. So, yon. So, dapat start kayo. Huwag kayong basta-basta titingin dun sa sagot, ha? Nakita ko kanina paano kayong magsagot ng exam tips for you guys. Look first whether or not this is acid or alkaline electrophoresis. After that, check first what is being asked. Okay? Huwag nagmamadali. Nakita ko kanina basta sasagot na lang eh. Pag tinanong ko kanina, yun yung napansin ko sa inyo eh. Mahihirapan kayo pag nagmamadali kayo. Okay? Kaya nga nilagay ko lagi dun sa mga sa mga activity ninyo. You should spend 30 minutes to an hour for this particular question. Hindi ko alam ilang minuto nyo tinapos yon kasi may sumagot ng basophil. Okay? Talagang yung basophil talaga yung naalala ko. So, alright? So, exam tips. Understand first whether or not this is acid or alkaline electrophoresis. Next, check first the controls. Okay? Kung saan bands nakatingin. And then next, check first what is being asked. Usually, the one being asked is the one where there is a question mark. But sometimes, examiners, they would change it into what is the unknown. Alright? Or they would say, what's the patient's result like? So they would sometimes paraphrase the questions and they just want to confuse you guys. So I want you guys to take it slow. Okay? Read the questions first. Alright? Next one. Pahirap ng pahirap ang mga challenges. I know. But this is something that you need to do. That's sickle cell trait. Alright. Now, this one. Let's first talk about the third option. The second option. The first one. Let's answer this one first. All together now. What is your answer here? 30 seconds on the clock. Based on our discussion earlier. 30 seconds. Mayra, anong migrated? Sorry. 30 seconds. Look at the question. We're answering this one first, ha. Huwag muna nating sagutin yung pangalawa. Okay? Ito muna. Makita niyo yung tinuturo ko, class. Okay? So let's answer this one first. Mamaya na natin reveal yung answers. Huwag muna nating i-type. Kasi gusto ko merong mystique. Diba? Alright. 30 seconds is finished. Let's go one by one with the students. Adrian, since you start with letter A, what's your answer? First one lang ha, huwag ka muna magsalita na. Ha? Pang Harlem, advanced! Advanced talaga mag-isip ang mga students. Mamaya na yung Harlem. Ano ba kayo? Alright. What about Deandra? Answer. Deandra, what's your answer? Deandra. Okay, let's move to Joanna. What's your answer, Joanna? Okay. What about James Garcia? Okay. What about Angel Montalvo? Okay. What about Noreen Fortunato? Noreen, I can't hear you. Can you just type your answer? Sorry, I can't hear you. Please just type your answer. There's a little bit of a feedback. Make it shh. There's a shh. Okay, so just... Okay, what about Charisse? What's your answer? Okay, what about Ana Jamema? Sickle cell trait. So there's two types of answers. It's from everybody answered sickle cell. Most of the people answered sickle cell HBSC, and then there's a couple of people who answered sickle cell trait. Okay, so a lot of people seem to have answered SC, which is actually the correct answer. HBSC. The correct answer is HBSC. Why? The simple fact that there is two bands being produced. Okay? No other band is being produced here. Alright? C, S, alkaline electrophoresis. Whether it's alkaline or acid electrophoresis, it's the same thing. Okay? So SC. It will appear the same way as it did in hemoglobin SC. Okay? Now, sickle cell trait, on the other hand, is something that is a little bit suspicious for you guys, I suppose. We still need to explain it for you guys. I still need to explain it further for you guys. So, don't worry, you don't need to ask. Let's just talk about it first. This is sickle cell trait. Again, why is this sickle cell trait? Because there's a clear band on hemoglobin S, and there's a clear band in hemoglobin A. Right? Why is this a trait? Because phenotypically, this will present as HBsA or HBAS. Sorry, the correct nomenclature is HBAS, not HBA, not HBSSA ha. HBAS. Kasi kung sino yung nauuna lagi na letter. Okay? Alright. Now, how did this become HBSC? Because, remember earlier we discussed that abnormal mutations between S and abnormal mutations between C can be inherited together. Right? Right? Diba tinanong ko sa inyo yan kanina as a true or false question? You can inherit both. Okay? Kaya nga tinatanong ko din sa inyo kanina kung can these people live a normal life. Sabi ni Adrian, no. No, he said no. But that happens and we need not talk about it clinically. But for you as medtechs, you need to understand that you can inherit them together. So, which means that if you answered HBSC, you already know the answer for the second question or for the second one here. What's the answer, class? If you've answered SC, you already know that the answer on the last one is hemoglobin C. Alright, very good. So, kaya ito yung explanation ko kanina. Okay? Bakit hindi siya pwedeng maging trait? Kasi ang pasyente na to, ang na-inherit niya, C at saka S. Okay? So, paano ito? Buhay pa ba to, sir? Of course, pwede pa yan mabuhay. Kayo naman. Huwag kayo masyadong masama sa mga pasyente natin, ha? Alright, natawa si Natawa siya. So, this is the correct answer. SC and disease. By the way, if you inherit both, you can write it as hemoglobin C disease. Hemoglobin SC is another one. Now, may tatanong ako. What's the electrophoretic pattern for patients with hemoglobin C trait? Ayan na, kinukonfuse na naman kayo ni Sir Manuel. Kasi wala akong case presentation nun. Hindi ako makahanap eh. What's the appearance of a patient with hemoglobin C trait? Very good. So may band siya sa C at A. Bakit trait? Kasi ang na-inherit lang niya is an abnormal gene of C, but because it's a trait, there's still a normal hemoglobin there, right? He or she inherited A as well. Kaya trait. Okay? Huwag kakalimutan yung nomenclature ha. Pag sinabing disease, SS, CC, EE. Okay? Huwag kakalimutan yun. Pag sinabing trait, SA, CA, EA. Okay? Clear? Clear? Klaro yon? Klaro? Klaro po? Klaro M recto? Okay? Now, bibigyan ko kayo ng activities. Wala na pala akong wala na ba activities? Kasi malapit lunch time and naamoy ko na ang pagkain ng baboy. Kaya bibigyan ko kayo ng activity. Oo. Naamoy bango. Naamoy ko na yung pagkain. So, last na pa, malapit na tayo before we move on to leukemia and coagulation. Hopefully, we have time for coagulation. Kasi last year, hindi ko na tapos yung coagulation sa mga students ko. Okay? So, aside from electrophoresis, what technique may be utilized to identify hemoglobin variants? I've said it earlier. HPLC. Anybody here knows what HPLC is? What HPLC is? Anybody? Somebody raises their hand. Ano Jemema ating? Alright, wonderful. Now, I know, right? I know! Medyo napawawa din ako pero hindi ko muna sinabi. Nagpo-poker face ako. Nakakainis ka naman, Sir Marco eh. Nagpapaano. Gusto nito ng pasalubong. Alright, okay lang sa akin yan. Alright. Very generous tayo. Alright. Okay, so we can use high-performance liquid chromatography. Now, what's the difference between electrophoresis and chromatography? It requires the movement of molecules, of course, both of them. But what's the main difference between liquid chromatography or chromatography in general? You don't require an electrical field. Okay? You don't require an electrical field in chromatography. And you need a mobile phase and a moving phase, or what you call the a mobile phase and the constant phase. Okay? So you need these two things. You require a column as well. So I don't need to delve deep into that one. That will be discussed further by the clinical chemistry, by your clinical chemistry instructors. But you can use HPLC. Now, limitations of these two. Hemoglobin electrophoresis can only be done if the patient's hemoglobin levels are within normal. Okay? So, parang kakaiba. Bakit ganun? Kailangan normal ang hemoglobin. Yes. You cannot do hemoglobin electrophoresis in patients who are suffering from sickle cell crisis. Okay? Why? There's constant destruction of cells. What else? These patients might have already been transfused with blood, so there will be double population of hemoglobins. Okay, so this is what we call acquired chimerism. Okay, and for high performance liquid chromatography, because we don't run it on a densitometer, okay, high performance liquid chromatography is much less accurate in terms of quantification. That's why in some hospitals they actually opt for both high-performance liquid chromatography and electrophoresis. In my hospital, we only do high-performance liquid chromatography, and if we want to confirm the diagnosis, we need to send it to electrophoresis. Because why? Because we want in hemoglobin electrophoresis, you can separate the other hemoglobin variants. In this case, you have to guess based on the percentages of the peaks. And this is an example of high-performance liquid chromatograph. This was actually taken directly from a lecture that I conducted here, from a lecture that I actually conducted there in Saudi Arabia for hemoglobin electrophoresis, high-performance liquid chromatography. Okay, so which one here do you think is normal? Based on looking initially at the at the peaks and the throws of the analysis. Which one here is a normal hemoglobin sample? Bilis, malapit na tayong mag-break. Kayo talaga class. Gusto ko na mag-break. Naaamoy ko na yung baboy. Ano? Normal. Which one is normal? Which one is not normal? Sige, start tayo with Norin. Kasi nagugutom na ako. Mamimili tayo ng mga student ngayon. Which one is normal? Which one is abnormal? Or both of them are abnormal? Ano, class? Kakain pa ba tayo? Wala? What about Angelica? May sinasabi si Joanna, both po ano? Both ano? Both normal. Both abnormal. Okay. Sabi mo ata. Bakit ata? Sige, you can say your reasoning. Don't worry. Hindi ko pa naman in-explain eh. Madidisappoint ako pagka in-explain ko na tapos hindi mo nasagot. Doon ako na-disappoint. Pero pag ito, hindi ko pa naman in-explain sa iyo eh. Bakit siya abnormal? Both. Saan? Sa kamay mo? Paano mo nagamit ang kamay mo, girl? Meron ka bang sickle cell anemia? Kasi isa sa mga Hoy! Sa ano yon? Sa iba yon, sa clinical chemistry yun, hindi yun pwedeng gamitin dito. Hoy, kayo talaga, mga student talaga. Sir Marco, ha? Ayaw talaga nila akong pakainin, Sir Marco. Dinidelay talaga nila ang pagkain ko. Left po yung normal, ata din. Okay. Si left. Normal ba na mag-peak ang hemoglobin S? Ana? Look at the variables. Look, guys. Look at the variables. Yan ang sinasabi ko. Ang mga students talaga mabilis sumagot. Ayan, oh. Look at the side here. Percent hemoglobin concentration here is 0, 15, 30, and 45. Normal ba na magkaroon ng percentage ang isang tao? Ana, itatanungin kita. Okay. Alright. Okay, when you look at the other side, Ana, normal ba na mag-peak siya at around 40? 43%? Hindi din, di ba? So, both of them are abnormal. Right? Now, my next question is for you guys. Anong mali? Tama yan. Kayo talaga tama yan. Mali ang pasyente. Kawawa naman yung pasyente. Mali ang pagkabuhay niya. Kayo talaga. Mali yung, para sinabi mo, mali siyang ipinanganak. Grabe naman kayo. Ang sama-sama niyo talaga, guys. Kanina Oo. Kanina si Adrian sabi niya, no. Kanina si Adrian sabi niya, no. Grabe talaga to mga estudyante mo. Grabe kayo sa mga pasyente na ganyan, ha? Alright, so my next question is, because both of them are abnormal, what then can we infer from these two graphs? What can we infer from these two graphs? Look at this one. May peak, may konting peak sa hemoglobin F, may konting peak sa A2, and then on this one, may peak sa A, mataas, may peak sa S, may peak sa F, tsaka sa A2. So, anong may infer natin dito? Hoy! Ay, nakalimutan nyo. Sickle cell anemia is an umbrella term. Remember, it's an umbrella term for a lot of conditions associated with sickle cell disease. Sickle cell anemia. So, it's just not a sickle cell anemia. So, sickle cell anemia can be trait, SA, or SC, SE. Umbrella term siya. Don't forget Mayra, ha? So, here, you're correct. I understand, but what answer I'm looking for is this one is sickle cell disease. But again, I say disease if it's an inheritance of both SS. Okay? SS. Okay? This one, may peak pa rin siya sa A, oh. Ibig sabihin, ang ina-inherit niya is AS. Gets nyo? Eh sir, kasama yung F at saka yung A2. Bakit ganon? Kasi, ang normal na tao, nagpuproduce pa rin ng A1, at saka, ng A2, at saka ng F. Huwag niyong kakalimutan, ha? Meron pa rin certain percentage ng katawan ninyo. Because why? Hindi naman kayo, tumanda lang naman kayo, hindi naman kayo nag-mutate at nagpalit yung A1, yung HbA1 gene yun, di ba? Di ba? Hindi naman siya nagbago. Ibig sabihin, mas nagiging active lang si A1 kaysa kay A2. Gets nyo? Clear? Clear. Kaya meron pa rin kayong F at saka A2. Hindi ibig sabihin nun na, oh my God, sir, abnormal yung patient natin kasi nag-produce siya pa rin ng F at saka ng A2. No. That is what we consider as a normal value. Kaya nga guys, laging sinasabi sa kaya nga kanina, 'di ba, nakita nyo yung yung limitations. It's not usually for accurate, it cannot provide accurate quantification. Okay? All right? So this is the one that I'm telling you about. Okay? HBLC, sickle cell disease, sickle cell trait. Okay? That is the end of our discussion for today, and makakakain na ako. Kaya please aralin nyo siya, ha? Please lang. Okay? Okay? Clear? Clear ba? May tanong? I'll give you guys 2 minutes to ask me questions, and if you can't ask me now, you can think of a question now. You can type it on the chat, and then I'll look at it later. Okay? Adrian, are we still connected or disconnected in our YouTube recording? Okay. Parang wala sa mood si Adrian. Parang nakahalumbaba yung mukha ni Adrian. Okay lang yun. Alam ko may hindi na pinagdadaanan yung mga pasyente na mga may may HBSS tsaka HBSC. And they can't live a normal life as what you would consider, but it's okay. It's okay for them. Alright? It's okay for you also to think of them that way. It's normal. But anyway, that's it for me, and we're going to talk about leukemia later. If you have questions, okay, Joanna, what's your question? Ayaw mo talaga akong pakainin, Joanna, pero sige lang. Yung Sige. Hindi naman ako magagalit. Magagalit ako, madidisappoint ako. Hindi ako nagagalit, nadidisappoint ako. Hindi, sige, ngayon na. Baka makalimutan ko pa yan. Bahala kayo. At saka remember, pag gutom ang tao, tinatawag na ako. Pag gutom ang tao, mas gumagana ang utak. Okay? So ano yung question natin? Huwag mahiya. Right med ang tama. Charot, right med. Sige, ano. Tagal, Mayra. Ay, Joanna. Ano? Okay. Sige. Huwag kang mag-alala. I got you, girl. Sabi nga ni Adrian in his accent. Girl, I got you. Ganon yung accent ni Adrian. I'm just imagining, ha? I'm not really sure kasi parang nagbago na yung accent ni Adrian. Alright, we're gonna come back to this one. Alright. So, normal hemoglobin, bakit may fat band? Sabi nyo? Kasi look at this one. Right? Your hemoglobin, majority of your hemoglobin being produced is what? Is HbA. Then, it's in the A zone. Okay? A fat band is here. No other bands are produced. Okay? Why? Majority is A. This one. What is this? Anybody can answer? What's the second one? This one? Is it trait or disease? Trait or disease? This one, the one that I'm pointing at. Paano ko nasabing trait? How can I say it was a trait? There's a fat band on S. There's a fat band on S. And there's a thin band on F. Okay? Why is there F? Bakit ako nililito ni Sir? Kasi F is the compensatory hemoglobin in the absence of normal hemoglobins. Okay? Alright? Next. This one is what? What's this? The third one. Combine nyo na lang. Huwag nyo pahirapan sarili nyo. Combine nyo na lang. A at saka S. Ano ang phenotype mo? Anong tawag sa'yo? Kapag ka, nomenclature-wise, anong tawag sa'yo? Oh, di ba? Dito, tingnan mo. Ang naging ano sa'yo, ang na-inherit mo ano? S at saka F. Eh wala naman tayong HBSF, di ba? Meron ba tayong diniscuss na HBSF? Wala. Why? Because F is the compensatory hemoglobin that is going to be produced if you are a person who does not produce normal hemoglobins. Say, di ba? What is the gene that is what's the gene that produces hemoglobin F? It's the A2 gene. And if there's a problem with the A1, A2 will come and produce the genes. Right? So compensatory wise, it will produce F. Okay? Gets nyo kung bakit fat band tas may ano? Alright. This one. Sickle cell disease. We already know this. This is sickle cell trait. This one. Bakit ito, sir? Walang small band sa F. Feeling ko yan yung naging nalilito ka. Tama ba? Diyan ka nalilito. Bakit ito walang F? Double dose ng CC. Gets nyo? Paano madaling maalala? Kung ano yung nakita mo. Pag mataba, okay? Imagine nyo, dalawa yung kasama. Nakita nyo kung paano siya kapayat? Pag pinagdikit nyo yung payat, naging mataba siya. 'Di ba? So, 1 plus 1, ganon. So, pag mataba siya, imagine niyo double dose na kaagad. CC. Okay? Bakit walang F, sir? Kasi, abnormality niya is beta gene. Kung abnormal ang beta gene, patay tayo dyan. Gets nyo? Kasi, walang alpha gene na abnormality. Wala siyang problema, di ba? So, kaya walang F. Okay? Gets? Okay? Gets? Alright? Cool beans? Any more questions? I can explain for you guys. Don't worry. O, di ba? SS. Pwede din yung isagot yan. You have to be mindful of nomenclature, what it looks like in the hemoglobin electrophoresis, what it looks like in the hemoglobin HPLC. Okay? These are the things that you guys need to remember. Okay? Now, sir, pwede ba naming malaman ng HBSC kapag ka meron tayong hemoglobin electrophoresis pag HPLC? The problem is no. There's a limitation. That's another limitation. It's a manufacturer limitation. This is done by D10, by Biorad. Ibig sabihin, there are other machines out there. Okay? I just added this for you guys because I work specifically in this type of machine, so I can explain it to you guys. But for other machines, it's quite difficult to understand for you guys. It's extremely complicated, and for exam purposes, the ones that I'm presenting for you guys are easier to digest. 'Di ba? Basophils nga sinasagot ninyo kahit walang basophils eh. Paano pa kaya yung gamit kapag gumamit yung HPLC result ni Beckman Coulter nakasama yung mga HBL Lepore at saka yung mga HBO. Hindi na yung sinasama. Rarely tested yon. Huwag kayong mag-alala, guys. Gusto ko mangyari sa inyo makapasa. Okay? Alright? So that's it. This is the end of our discussion for hemoglobinopathies. Okay? That is our last discussion related to RBC abnormalities. We're going to move on with something so much more difficult, which is leukemia. Okay? I can see them also. Lalo na si Angel, nakanguso. Parang wala akong naintindihan, sir, pero nahiya akong magsalita. Sabi ko sa inyo, I am a person who can answer the questions for you when you need clarifications. Do not be shy.